So now we've been using narrowband UVB for about 40 years, and it's very effective. Anything with vitiligo takes time, so you have to be patient. But and it's very hard to get access to it. So you have to be near a dermatologist, or you have to be able to buy one of these panels for your home, and you need to use it 2 or 3 times a week. It only takes about 5 minutes per treatment, but if you're driving to a dermatologist's office, that's can be a pain. Um, in terms of improvement, we usually expect to start seeing improvement in 8 to 12 weeks. So you have to be patient. A lot of time people give up treatment before that, before they start to see the improvement. And so patience is really important. We start 2 to 3 months, we start to see improvement. 6 months, we see some really significant improvement. And actually, on the face, people can get 100% better on the face within 6 months. The body takes a longer time. And so that might take a year or a year and a half, and it may not ever get 100% better. You may get 80% better or 90% better. So understanding that is really important. The parts of the body that respond best to treatment are parts of the body that are covered in hair. Briefly mentioned that in my presentation, that hair follicles are where the new baby melanocytes come from. The stem cells live in the hair. And that hair, if it's turned white, those cells actually have been destroyed. So you need normally pigmented hair on your body. The good news is most of the body is covered in hair. Even the face, even in a woman, there's hair there. It's just almost invisible. You need a magnifier to see it, but it's there, and it's sufficient to bring the color back, just like in a man with a beard. Um, so you can imagine the more hair, the better in terms of bringing the color back. And so the face is very easy to treat. That's why it responds so quickly. The fingertips are almost impossible. There's no hair follicles in the fingertips, as you can see. The underside of the wrists, this is another area where there's no hair follicles. The back of the hand is pretty variable. Some people have really hairy hands. Some people have very little hair in the hands. The more hair, the better. So if you have hairy hands, treatments work. No. So I get that question a lot, and sometimes it's about menopause, sometimes it's about puberty, and sometimes it's about pregnancy. So generally, we don't have links between hormones and vitiligo. And the reason why I say that is because we don't see a big change in vitiligo when a child has vitiligo and then goes through puberty. We just don't see any change from those hormonal changes. We also don't see a change before and after menopause. Um, we do see a change during pregnancy, and that may be due to pregnancy hormones, or it may be due to, the stress of on the body of being pregnant. The body goes through a lot of changes. So we do see that frequently, but not. We don't think it's because of hormones, and we don't see the birth control pill having an effect on vitiligo, and we don't see treatment of breast cancer, having an effect on vitiligo. So we don't think there's a connection there. Well, the microbiome's complex, and it probably affects our health in many, many ways that we don't yet recognize. And there are some early studies suggesting that the microbiome is connected to vitiligo. There are even studies actually in melanoma. So believe it or not, when some of the new amazing treatments we have for melanoma treat melanoma by causing vitiligo. So we're actually pretty good at causing vitiligo in people in order to save them from their melanoma. And we know that actually the microbiome plays an important role in that. If you have a certain microbiome, then we can trigger vitiligo better to treat your melanoma. And if you have a different microbiome, it's harder to do. And if you change the microbiome, you can do it easier. So I believe that the microbiome probably does play a role. That's part of what we're studying. It's very complicated. As you can imagine, the microbiome is very complex. There's lots of viruses and bacteria that live on your body, and trying to understand how they all interact with your body is complicated. But we're working on it. So about 20% of people report itch when their vitiligo is moving, and almost everybody who reports itch with their vitiligo, it's because their vitiligo is spreading. So vitiligo can spread and it can stabilize, and then later on it can spread again. Most of the time, we only hear the patients reporting itch when their vitiligo is actively spreading. If it's stable, we don't hear that. We don't actually know the answer to that. I talked about, all these cells crawling around in the skin and killing the pigment cells, and usually those, cells can crawl through your skin and not cause any symptoms because they do that all the time. That's how we fight viruses and prevent cancer and all that. I think when vitiligo is really vigorous, I talked about the ants. The one ant goes up there, you probably don't feel that, but when it calls in all its friends to come in and help, you can imagine that actually might create a sensation. And so I think that's probably what's causing the itch. But we're working on it. We're trying to figure out more and better. And actually, that itch goes away very quickly with Opzelura. So that's one benefit of being able to have access to that. It's interesting. A lot of people are referred to my clinic with vitiligo, and then one of the first questions we have to ask is, do they actually have vitiligo?
Mhm.
Um, and I've also had patients with vitiligo come in for a checkup, and they say, "You wouldn't believe it. Last week, it spread all over my body." And I'm very skeptical because I've never seen that happen before. So then I have to look and see what they're talking about. And you heard the term tinea versicolor from an earlier speaker. This is a fungus that grows on the body very commonly. I've had it actually before on my own body, and it causes light spots that aren't vitiligo. They're not white spots; they're light spots. So I've had patients with vitiligo who got tinea versicolor too, and then all they got, the sudden they got all these spots, and they were devastated because within a week, all of a sudden they thought their vitiligo had spread. We were able to give them a shampoo, get rid of the tinea versicolor, completely got better, and and showed that that was not vitiligo. So sometimes people with vitiligo get other things. Usually, if you get tiny little white spots, if it's happening on the arms and the legs, that can be a different condition called. I hesitate to say it because it's called idiopathic guttate hypomelanosis, right?
Wow.
Crazy, stupid derm term that we use. It doesn't mean much. It just means we don't know what causes it. It causes little white spots, and they look like little dots on the skin.
Mhm.
So I have lots of patients with vitiligo that also have this IGH for short. I even have one on my arm, and I found another one today on my leg. This is actually from chronic sun exposure. So if you tan very easily and you spend a lot of time in the sun, you can get these little white spots that are not vitiligo, but are these other things. The reason I get into all that is because treatments that we have, even Opzelura, light therapy, will not help IGH and these other things. So getting a proper diagnosis, I think, is really important. We have not found any vitamins or supplements that reliably make your vitiligo better. I can say ginkgo is one that there were a couple studies that suggested that ginkgo might have helped a little bit as long as you're using the other treatments. It made the treatments maybe work a little bit better. But then other studies showed that ginkgo biloba didn't help at all. And so it's hard to know, really how much. I usually tell my patients, if you want to try things, that's okay. I usually don't recommend it because I know what works. Like we can focus on those things. I don't want you to spend a lot of time on things that we're not sure if they work. The other thing that's challenging is vitamins and supplements are not regulated, at least here in the US. They're not regulated by the FDA. And so literally companies can put whatever they want into the pill and say whatever they want about it. And there were studies actually done where they went to stores and they bought supplements like ginkgo biloba and then tested the pill and showed that there was no ginkgo biloba in it. It was houseplants. And so they could actually grind up houseplants, make a pill out of it, call it ginkgo biloba, and sell it. And so even if I suggested you go out and buy ginkgo biloba, I don't know where to tell you to get it. I don't know who's trustworthy. And so that makes, studies even more challenging because I can't even do a study testing ginkgo biloba if I don't know there's ginkgo in it. Yeah, we just did a study actually and published this and showed, and there have been other studies before us, which is why we did the study. We did it in children. Other studies have been done in adults, and it turns out that there is an increased risk of hearing loss when you have vitiligo. And it's interesting, there are pigment cells inside your ear, and we don't know exactly what they're doing there, but they appear to protect your hearing. Um, and so if you have vitiligo, if those cells get attacked too, you can imagine that it could have an effect on your hearing. Um, the good news is we haven't, it's not like we're finding that people with vitiligo go deaf. It's just on formal hearing testing, there are a few. wavelengths of hearing, not wavelengths, but we call it, it's in hertz. It's a part of the sound spectrum. That's what's lost. So you may actually never even notice you've got hearing loss, but if you go in and have formal testing, you may have a reduced range of what you can hear. And it's not so obvious that people are complaining about it, but we're trying to understand it better. Yeah, that comes up a lot. And we actually had one patient that we published who got vitiligo at the site of injection of the vaccine. So we think that that probably, because it was the vitiligo started right where the vaccine was administered, that that was probably the case. Um, we don't have lots of evidence that the COVID vaccine or other vaccines are driving and causing vitiligo. We also don't really have evidence to the contrary. But what I can say is, my vitiligo clinic operated before COVID, during COVID, and after COVID, and I have not seen lots and lots of new vitiligo cases since COVID or since the vaccines were administered. So, that's one thought. My thought that I don't think this is happening in large amounts of people. I didn't see, people with two, three, four times more people with vitiligo calling me, after the vaccines came out. However, the purpose of the vaccine is to activate your immune system and get it active so that it does a good job fighting the virus. And so I can imagine that if you get your immune system activated, then that could increase your chances of getting vitiligo. But what I'm saying is I just haven't seen that happen. You may or may not have seen a very high profile study that was just done out of Harvard, a new treatment for type 1 diabetes. So actually type 1 diabetes, the story is very similar to vitiligo, except it's insulin making cells that get targeted and killed rather than pigment cells. I started my research career in type 1 diabetes and then actually started to study vitiligo instead. But I'm very interested because I think when we make discoveries in vitiligo, we'll be able to use those discoveries to help type 1 diabetes. So the good news about vitiligo is that it's reversible. So we can give treatments and the pigment comes back. And that's because the pigment stem cells survive vitiligo because they're hiding in the hair follicles. And the hair follicles, for some reason, often keep vitiligo out. So there's that protection. So all we have to do is shut off the attack, and the pigment cells actually will come back on their own, those stem cells. In type 1 diabetes, that doesn't happen because there are no insulin cell stem cells that are protected. They're all killed. And so this new study that was tested was a gene therapy kind of stem cell productive approach where they were able to take regular cells from a patient with diabetes, convert them into insulin making cells, and then transplant them into the patient. And those patients actually didn't require insulin anymore. So I'm often asked, well, what about stem cell therapy? What about gene therapy? What about all these things? Would that make vitiligo better? And I would say, actually, we don't need most of those therapies because the stem cells are already there. And so we're already a big step ahead. That's why we have treatments for vitiligo, and we don't have treatments for diabetes yet. And so could gene therapy, gene manipulation, stem cell production make it better in the future? Maybe. But I would say right now it's not a huge need. And we have that advantage in vitiligo that we don't have to go that route yet. Research is really hard. So what I showed you in 15 minutes is 15 years worth of work. So a year of work I showed you in a minute. And that's because so many things don't work. And I don't bother showing you those things, that this great idea that we had that didn't work at all. And so I think that we fool people into thinking research is easy and if we just worked harder we'd do better. I appreciate those who appreciate that what we're doing. It's not easy. It's a really difficult task. Learning the light switches and everything. It's one thing if you have a house wired, you can just track the wires back and figure out where everything goes. In the human body, there's so much that we don't know. We have to make discoveries. That's very exciting for us. It's not just, we don't do it just as a labor of love, but it's fun, and we're really motivated. And it's not just me. I showed you the picture of the team. There's 20 or 30 people who are really working on this behind the scenes and just as dedicated as I am.